Thank you for joining us for Ask a Therapist, the Blue Cross Blue Shield of South Carolina series in which we speak with local mental health professionals about issues many people face every day. I'm one of your hosts, Ryle Curtis, and today we're joined by Dr. Jennifer Heath, a medical director with Blue Cross, to talk about the rising use of social media by teens and young adults and the impact that social media can have on mental health. Let's jump right in. Dr. Heath, what can you tell us about the connection between social media and mental health as it relates to teens?
Well, it's a very broad topic, and there's lots of information out there about it. I think to get a good understanding about the connection, it's good to think about the scope of the issue and what's happening with our youth. So, in a survey of 8th and 10th graders, they reported their average time on social media was 3.5 hours a day. 1 in 4 reported spending 5 or more hours a day, and 1 in 7 said they spent 7 or more hours per day on social media. That gives us context of how much time kids are spending on their devices or computers on social media. Another survey of girls aged 11 to 15 said a third or more of them reported that they felt addicted to their social media app. And over half the teens say that it would be hard for them to give up their social media. Showed you that it is an issue that, as a society, as parents, as healthcare providers, we all need to pay attention to. One more study, a survey of youth, said that 95% of youth ages 13 to 17 use social media, and more than a third reported that they use it almost constantly. And what's interesting is even though that most social media apps have a minimum age of 13, about 40% of children ages 8 to 12 use social media. So that's, again, another time where parents probably need to be really involved and check in with their kids if they're in the younger age using this. Given the use of social media with those ages and then the rise of adolescents struggling with depression and anxiety, a lot of research has come out, and most recently in May, the U.S. Surgeon General released an advisory about social media and youth mental health. And I think that's an important reference for people to review, to listen to families to learn more about this topic, because it provides tips and helpful things that families can use to deal with this issue.
Are teens or younger people, are they more susceptible to have negative mental health effects from social media?
Yes, teen and young adults are more susceptible to the negative mental health effects from social media due to this being a critical time for brain development. So if you consider this time of development, this is when risk-taking behaviors peak, and sometimes depressive disorders can start to emerge during this time. So excessive social media use may be associated with changes to the developing brain, especially in areas that are related to emotional learning and behavior, as well as impulse control and emotional regulation. The changes in the brain have the potential to increase the teenager's sensitivity to social rewards and punishment, and that can lead to difficulty with self-worth and a decline in mental health if they're feeling more sensitive to the online feedback that they are receiving. So it is a very susceptible time for teenagers to be engaging in social media.
Looking closer at that group of teens and young adults, are there certain groups who may be at higher risk?
Yes, adolescent girls and teens that are already experiencing poor mental health are at a higher risk of harm related to social media use. Worsening mental health that can lead to self-harm or suicide is also associated with social media use in teens that are dealing with cyberbullying related depression, poor body image, disordered eating behaviors, and poor sleep. So these teenagers are at risk of potential harm from the social media use. Other at-risk groups include racial, ethnic, and sexual and gender minorities. Over a third of adolescent girls of color report exposure to racist content or language online and social media apps. Adolescent females and sexual minority youth are more likely to experience incidents of cyberbullying. So those are all concerns that would place them at higher risk for having a negative outcomes related to social media use. However, on the other hand, there's also been studies that shown social media may support the well-being of sexual and gender minority youth because they're able to find peer connections and social support groups online that they might not have in their community. And there are some reports for girls of color reporting that they've found positive role models online as well. So while there are the negative sides, we also are studying and looking at the positive effects as well.
When it comes to the negative mental health effects for social media on teens, what are some of the more common warning signs that parents should look for?
I think it's important to note that there's two different concerns when it comes to social media use in adolescence. It could be excessive use, such as spending too much time on the social media platforms or online in general, and also being exposed to harmful content. So, both of those can have a profound impact on mental health, leading to an increase in anxiety, depression symptoms, eating disorder symptoms, low self esteem. So, what parents should look for is if they notice any significant changes to their teenager in their behavior, such as if they become more withdrawn, they are more isolative, trouble sleeping, or more fatigued during the day, that might be a sign that their phone usage at night or their social media use is interfering with their regular routine. If they notice a change in eating habits or your teenager's weight, that could indicate a concern about body image issues related to their social media use. And then when it becomes more of a problem as far as developing depressive symptoms, if you notice they seem to have a loss of interest in activities they usually do, or decline in grades or their academic performance, those would be reasons to be concerned and probably seek help by starting with maybe speaking to your pediatrician after you talk to your child about what they're experiencing.
I want to thank Dr. Jennifer Heath for joining us today for our Ask a Therapist podcast. This conversation around social media and mental health is so important. We hope this discussion can help you or someone you know. Blue Cross Blue Shield of South Carolina members can contact the phone number listed on the back of their member ID card for mental health resources. We hope you'll join us again for the next Ask a Therapist podcast.